be able to pick up heart defects during the pregnancy and reduce the damage. So could you tell us a little bit about what's happening in your department now with trying to identify problems early on in pregnancy and how you're not so good at it might be. When you pick some of them up, you can't do anything about them, but I'm sure some of them you can do something about them in preparation for.
So this is one of the big sort of developing areas in our field. For us to know that a baby is going to be born with a complicated heart problem is really beneficial in two ways. First of all, it allows us to know that as soon as that baby is born, that we are alerted to the need to start treatments early. And by doing that, we can often prevent babies becoming sicker and keep them stable. We have done a lot of work over the past few years in terms of trying to improve the detection of heart problems before birth by giving training to the radiographers who do the routine 20-week scans, and that's been very, very beneficial. In Northern Ireland at the moment, we have one of the highest pickup rates of heart defects before birth of any region in the United Kingdom or Southern Ireland. So that's good. It allows us to plan the delivery. As you said, we can't actually do things to treat the structure of the heart whenever the baby's in the womb. There are conditions that affect the rhythm of the heart where we can give medications to the mothers, and that certainly helps very, very much. So this is an area that I think will evolve further in the future. What we would like to do is to be forewarned of the patients who have severe heart disease before they're born. And it's not just us. It is very devastating, obviously, for a mum and dad to have the diagnosis of a congenital heart defect. It's not easy at any time. If you hear that during the pregnancy, then it changes that pregnancy for sure. But what we do is that at least that gives us a chance to prepare those families for what will happen after birth in terms of treatment and to outline to them. In my experience, the most devastating thing is to have to go and tell a mom and dad who've had a baby who for 24 hours they think is perfectly normally healthy, and then go along and tell them, well, in fact, there is a very serious heart problem. And that's, I think, more difficult than being prepared for it. And so both medically and for the well-being of parents, this is an area that we focus on very much.
Thank you very much.